The coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, has disclosed that the federal government has committed the sum of 2.6 billion naira for the revalidation of primary healthcare PHC facilities across the 36 states of the Federation. Professor Ali made the disclosure at the sectoral ministerial press briefing in Abuja to mark the first year in office of the President Bola Ahmed Tinubu's administration in the country. He stated that the primary healthcare facilities have been expanded from 8,300 to 17,000, noting that the expansion is being managed by the National Primary Healthcare Development Agency, designed to ensure the health services in the country reach many more Nigerians as against the norms in the country.
More than 2,400 health workers, nurses, doctors, midwives have been recruited in facilities to provide services to Nigerians, many of them women in rural areas to provide essential services. So we've started to move in that direction. In addition, on vaccination, more than 5 million Nigerian children received vaccinations against diphtheria. If you recall, by August, September, Nigeria was in the middle of the diphtheria outbreak. Now it's sort of gone by the wayside because there was an intense effort to vaccinate. More than 10 million Nigerian children received the tetanus and diphtheria vaccines, while more than 5 million received the pentavalent vaccines, which is to protect them. And routine vaccinations have continued to be delivered all across the country, including the oral polio vaccine, which has been provided. This is on the primary healthcare side. In terms of the revitalization, which we have announced, we will get to 17,000 in line with the President's directive. I'm very pleased to say that there is 260 billion naira sitting right now at the state level, all the states of the Federation. Those have been mobilized for the revitalization of the primary healthcare centers. This is resource that is from International Development Association, IDA, and from the Basic Healthcare Provision Fund. Because when we said we're going to revitalize our primary healthcare centers, the key to do that is the resources to be available. So a lot of the effort that has been going on over the last several months to mobilize the resources to be able to deploy, and the states have this 260 billion in their pocket available. We are now at the stage where we're providing guidelines for them in terms of the bill of quantities, but to guide the states in the implementation of the revitalization and equipment of those facilities.
Speaking further, Professor Ali said many health equipments have been provided by the federal government across the 36 states of the Federation, noting that over the last 9 months in the 33 federal teaching hospitals, 4.5 million Nigerians were able to access outpatient services and 1.6 million Nigerians have inpatient admissions as 78 million Nigerians sought medical services from federal government hospitals.
29 discrete important equipment that were procured by the federal government across the 36 states of the Federation. Over the last 9 months, in 33 federal tertiary hospitals, 4.5 million Nigerians were able to access outpatient services, and 1.6 million Nigerians have inpatient admissions in those 33 facilities. So if you extrapolate for the 72 facilities, you can logically expect about 78 million Nigerians who are ill, who sought services from federal facilities, and about 2.5 million Nigerians who have gotten inpatient admission in our facilities.
It was gathered that with the state's development partners and civil society, the private sector gathered to articulate an agenda that aligns with the President's overall reform agenda in health and aims to save lives, reduce physical and financial pain, promote health, and ensure it is accessible to all Nigerians.